Hello, and welcome to the Health GoLive webinar series. Today's episode is brought to you by our friends at Placer AI. We would like to remind you that the Q&A feature is available, so feel free to send in your questions and comments throughout today's webinar. We would love to hear from you. And with that, I will turn it over to our moderator, VP of Marketing at Placer AI, Stephanie Atiase.
Hello, everyone. Thank you so much for that introduction. My name is Stephanie Atiase. I lead brand marketing here at Placer AI, and excited to be with you to talk about the retailization of healthcare, such an important topic. I'm here with Tomer Showal, who has a wealth of experience. Tomer and I have been working together, and I'm always excited to learn from him on everything related to healthcare. He leads our healthcare vertical and excited to hear more from Tomer.
Thank
Uh,
you, Stephanie.
of
Excited to have a chance to interact with you and hopefully have a great session. Just to briefly introduce myself, I've been an entrepreneur and builder my entire career. My first run was in e-commerce, and then just hitting a wall with medical bills in the healthcare space. I decided to start a company called Simply with a couple of co-founders. We kind of modernize and digitalize the patient experience when it comes to billing and payment, trying to kind of elevate the pain of medical bills when people need to focus on getting better. And really fell in love with the industry. I feel like everybody's whatever they're doing, it's a grind, it's hard work, but when you can connect to the mission of saving people's lives and kind of helping communities, it's I have such admiration to the people that work in the healthcare space, clinically or administratively. And the retailization of healthcare to me is just another step in the right direction that's been going on for the last decade plus, where healthcare is kind of always been behind a little bit in terms of consumer experience, in terms of service, and it's catching up and progressing and improving. And I think this is just another step in the right direction.
I love that. You mentioned a passion for the mission and all your success in being an entrepreneur. Can you share a moment in time when you realized that you had a deep connection to the mission around healthcare?
I mean, I think after my first run, I really kind of got addicted to the notion of building value and tackling a big pain point and kind of getting a lot of people excited about it. And then you see the business starts to pick up and consumers are kind of adopting it and you see success. And I really wanted to do it again. And my first pass was, okay, I know e-commerce, I'll try and do something there. And I felt like I'm wasting my time a little bit because all the big problems were kind of tackled and I couldn't get connected to something. And then just had a horrifying vacation with my wife and kids. Everybody got sick. It was the
Oh,
worst week
no.
of our lives. And at the end of that, I kind of rushed to the hospital with my daughter. She had pneumonia, she was fine, but 2 months later, a pile of medical bills. It kind of
Wow.
hit me. This is really broken. This is such an
Mhm.
important aspect of everybody's lives. E-commerce was,
Right.
yeah, it's about finding products, good deals, lower price. It's all good. But when it comes to like, hey, a busy mom, her son is sick and she's worried about it. And now she needs to kind of figure out how to deal with all the mess around billing and payments. It kind of hit me. This is really a great industry to be in because the people that serves and quite frankly, I'm just a tech guy. I'm talking about the nurses and the doctors and the technicians, everybody that goes every day to the hospital. It's such an important thing that this industry is doing. So it was kind of a no-brainer for me that I had an amazing 15 run with Simply and Placer was just an easy decision to say, okay, I have another chance to do something important in healthcare. I definitely want to opt in.
I love that. I love that. I know we've talked about how I spent years as a consultant working in consumer technology and healthcare. And I remember experiences where you realize the importance of all the key people on the ground making a difference in people's lives. And you've just highlighted the work that you've done, really changing people's lives through the innovations that you've created. So thank you so much, Tomer, for sharing. There are some key trends that we want to talk about. We want to highlight things that we've observed over the last few years. And a few of those key trends have really had an impact on everyone's lives. And so, in talking through the key trends on the next slide, telemedicine has been a big part of our lives, especially post-pandemic. And it's really enabled people to bring healthcare into their home, create efficiencies, allow them to solve problems quicker, and reduce wait times and improved accessibility. We've seen this increased focus on consumer experiences, and who doesn't like, as a consumer, to feel like the company that you're working with cares about you and cares about the process that you're experiencing. So that definitely improves patient satisfaction and improves loyalty to the care provider. Naturally, we're seeing AI-driven personalization, and everyone's talking about AI across every vertical. And in healthcare, it's even more important because it allows us to have a higher level of accuracy around understanding how best to solve some of these healthcare problems. Naturally, we're looking at health and wellness partnerships. You're seeing this integration between like healthcare providers and other wellness providers, and really thinking about the patient not just as somebody who needs immediate care, but like long-term wellness focus. And so super excited about that too. Connected to wearables and health monitoring systems. So if you're going to focus on wellness, you need to actively track how you're performing from a wellness perspective. And like, who doesn't love like checking their Apple Watch to check how many steps they're doing in a given day? But even more than that, some of the other vital metrics that we in society really want to check. But the one that we really want to focus on are the retailization of health clinics, and like really thinking about ways in which we can take some of the trends that we've seen in retail over the past probably 10 to 15 years and apply them in a health setting. With that, I know that there are a few different use cases and insights that you want to share. Do you mind sharing a couple of these interesting insights?
For sure. If you don't mind to go back to the
Oh,
previous slide,
sure.
I just
Yeah.
want to add just a couple of additional points to this great overview.
Mhm.
First, I think historically healthcare has been an industry that was driven a lot by kind of physicians. They were like the kings. Everything was kind of based on what they believed the workflow should be. And I think that notion broken, and now everyone understands that simply patients are consumers, right? It's the same notion. And everything is now driven by how do we make things easier, more convenient, transparent, empowering to those consumers that are basically just patients. This is just one aspect of their lives. And you can see this wealth of type of initiatives that kind of started to close that gap. What I've done in with Simply was literally taking paper statements that nobody could understand and make it a simple, easy experience to just understand and pay your medical bills on a mobile device, right? Let's get the busy mom to do things quickly on her own. She can save time, she can save money. And that would get her to say, that's another reason to potentially interact with the system that I'm interacting with locally. And then the retailization of healthcare, that's just another step in the same direction. How do we basically move people from driving into the acute care hospital? It's long drive, it's very expensive, it's kind of cumbersome. It's not necessarily a place that you enjoy going to with your kids, and figure out a way to just make it a lot easier and more accessible for consumers. Um,
Absolutely. No, thank you for great insights. And so if we think about some of the trends that we've seen and the insights that we've observed with some actual companies, and the examples ahead, we would love to review those.
yeah, if you can, perfect. So this is a perfect example of cross-pollination, partnership between different industries, right? In this case, it's healthcare and grocery stores, right? Grocery stores want to create more excuses, more triggers for their communities to come and visit them, both in terms of like, how can I get you to come to my grocery store versus my competitor next door? And the other is also, how do I get to potentially deliver more of your needs? And in this really impressive example, and we kind of used our Placer foot traffic data to demonstrate that you can see different grocery stores that we compare their traffic when they have a wellness clinic inside a grocery store versus their kind of average um, um, traffic to their chain. So we're basically benchmarking their average visitation into those stores that have a wellness store inside, similar to a minute clinic at the CVS store, right? You go to that drugstore and you can get your drugs, you can do immunization, similar type of services. And the results are pretty remarkable. You can see a pretty significant increase in traffic. And again, it's because you can get more people to say, you know what, let's go into Kroger because there's an opportunity there that I can get flu shots for my kids at the same time that I'm going and doing my grocery. And again, sometimes it's just the excuse of, you know what, my daughter doesn't feel very well. I'll go to see a quick clinician. It's just around the corner. It's not a big commitment. And by the way, I'm there, so I'm gonna also get some groceries for dinner, right? So that's one really good example of that win-win type of impact. And the next slide, it's even more sophisticated because here you can see it's not just about increasing visitations or traffic or awareness to your grocery store. This actually starts to impact the type of audience that is coming into your store. So in this example, if you're looking your grocery store that is aiming to serve families, what a great impact of adding those wellness clinics, because now you have a better opportunity to serve those families with young kids that are coming in for that as well. So I thought those two kind of examples of both getting more traffic and even influencing the audience towards the one that is a better fit for you, it just shows you, I would say, the potential of partnering and collaborating with healthcare providers in a retail setting. Obviously, and we'll talk about it in the next slides, there is the benefit for the providers as well. But if you're kind of in the retail space, you can think about, hey, when I add healthcare into my mix, that can have a pretty significant impact on my ability to compete and to lead in my space.
Absolutely. Something I hear you say all the time is healthcare needs to be part of the community. And the retailization of healthcare is a big part of that, is making sure it's at being healthy is at arm's length for every person in the community. So super excited about that. So there are continued trends that we've seen in ambulatory care, and we think that we need to make sure that everyone knows what they are to ensure that they can take advantage of it. And the first one is consumer is king. Tomer, tell me more about that.
Yeah, so this trend of trying to meet the patients where they're at in the community is a trend that's been progressing over the years. And by the way, it has different dynamic. It's both there are emerging companies, retail health type companies that are basically starting to emerge in the space. It can be companies that are doing direct primary care, so some type of a subscription fee primary care for the day-to-day needs of the family. It can be urgent care or even freestanding ER that's now in the community closer to home. And we've already seen not just the emerging young startups, but it can also be some of the established companies like Amazon or Walgreens or CVS that are putting that investment. Now, what does it mean? When you ask about the consumer is king, it's basically if I take my kid to an urgent care nearby, it means that I'm probably doing a better job from a cost perspective. If I go to an acute care setting, it's costs more money. If I go into a retail setting, it's much more competitive. So, that's a good way for me to lower my costs. Who doesn't want that, right? That's number one. Number two
Absolutely.
is convenience. Instead of driving 20, 30 minutes to look for a parking spot, find the right building, the right place to go to an urgent care, what's better than finding an urgent care that is literally in the retail node, in the community center next door? And we'll show later examples of how instrumental those type of best locations can be for the adoption of those type of services. So literally just saving time, right? Who doesn't want to do that? You always look for a coffee shop, for a grocery store, for a movie theater nearby. The same applies for healthcare. And as you said before, COVID was kind of a little bit of a trigger towards that. People wanted to stay close by, do things more remotely. So that was kind of one of the inflection points in that concept.
Oh, thank you. No, really helpful context. And in the second one, we want to discuss access reimagined. And when we say access, I know we're not just talking about the moment in which you engage with a doctor, but the process around engaging with a series of different doctors. Can you share more about that?
100%. This is very important, and that's an example where healthcare is very unique.
Hmm.
When you think about you making decision to purchase a product, a service, usually you can just go directly and do that. Healthcare, for the most part, has a referral system. You can't just decide, hey, I want to go to a cardiologist. You usually need to go to your general doctor, and they need to assess you and give you a referral. Or you go to an urgent care if you don't feel well, and that referral process starts from that point. So the point I'm making is, in terms of first point of contact, it's not just that if you're a healthcare provider, you want to make sure that you've got a really good footprint in terms of primary care and in terms of urgent care and freestanding ER, like call it the first doors or windows into the healthcare journey. But it's also an important aspect of how do you get those additional services that are coming as follow-up if you need to do an expensive imaging to examine your situation, some type of a sophisticated exam, if you need to find a specialist. And if those starting points are basically not part of your own ecosystem, your own system, now you're basically dependent on a referral of that patient to go and visit you versus your competitor. But if you own that, you basically have a much better chance not just to have a good business line on those front stores, but more importantly, on the additional services that are coming after that. Literally, the majority of healthcare is those referrals that are coming after those first point of contact. So they become such an important part of the strategy of a health provider that more and more systems are building urgent cares, primary cares, freestanding ERs, sometimes a combination of a multi-specialty clinic in the community. So they'll be close, they'll have that first point of contact, and from that, they can get those referrals. And it goes hand in hand with basically your strategic growth, because if that is so important, when you decide that you are going into a new market, that's the first thing you got to do. Okay, how do I put primary care? How do I put urgent care? How do I get that first line of service to the community? And from that, I can build those additional services.
I love that. And the last one, value-driven care. And I think this actually speaks to the mission point that you highlighted earlier, that everyone within healthcare should care about the overall wellness of their patient and figuring out the right incentives to ensure that healthcare providers care about their patients throughout their experience with the healthcare system. Can you share more about value-driven care?
Of course, and I'll start. I assume that the majority of the audience kind of knows healthcare,
Mhm.
but I'll just say that the basic notion of value-driven healthcare is coming from the fact that historically healthcare had been a fee for service. Basically, every time you go to the doctor, you get a drug subscribed, you need to pay money for that. So the incentive was to actually serve you more and more. That's how potentially more money is being made.
Right.
And in the last 10, 15 years, there is a very strong attempt to basically break that model into a model that incentivize the entire ecosystem to actually lower the cost of healthcare.
Right.
Without making it too complex, the base way to do it is to say, we can look at a community and say that this community is served at the cost of X. Let's say it's $1 billion a year. And tell the entities that serve that community, next year, if you serve them at a cost that is $100 million below that, now that can become a margin for you. So now you're
Right.
incentivized to actually lower the cost of healthcare. And how do you lower the cost of healthcare? You don't do it by just trimming services. You do it by providing better service to the community, by keeping people healthier, by detecting
Preventative care,
problems,
right?
preventative care, exactly,
Yes.
detecting problems early on and getting to treat them faster. And while you're not making as much money as before, you actually are, because if the overall went down, that kind of saving becomes basically the margin for those providers. And for example, Medicare Advantage, which is the insurance company for the elder population, 65 years and above, had been the first really great success of value-based care, where the government is paying a set amount per patient. And if the health systems and the insurance companies serve them at a lower cost, then they keep that saving. Now, how is it related to our conversation about ambulatory? Here's how. And I'll give you a great example. I know of a big system in the Florida area that is basically building primary care for the elder population, for the pediatric population, geriatric population, sorry. And their model is not only we're putting our clinics in the community, in those community centers and malls that the elder population spend times in, so it will be easier for us to get them to work with us. But we believe that because we're going to be where they're at during the day, we have a better chance to educate them. We have a better chance to treat them. We have a better chance to give them preventative care. So their model is not just, hey, this gives me a first point of contact and strategy growth. Their model is, we actually, by serving them close to home, we have a better chance to serve them better and to lower their costs. And that's very advanced, very sophisticated. And I believe wholeheartedly that that's part of how you create a win-win. The patient wins, they pay less, they don't spend as much time, the service is high-end, easier, and then for the ecosystem, the cost is going down. It gives them a better chance to meet you where you're at, and then basically continue to build their services and their businesses.
Wow, you just shared an amazing flywheel. I loved that example. So as we're thinking about the ways in which this is actually deployed, I think there are a few different use cases that we have that we would love to share. Let's start with the first one.
For sure. And just, I know this is a kind of an educational session, but I wanted just to give a brief overview about specifically Placer, the company we work for, in terms of an example of a location analytics company. But the point is to say that you can deploy this type of technology with other potential partners as well. The point is just, if we just until now showed you that, hey, meeting patients where they're at in the community is good business for you, it's the right way to serve into the future, let us give you a couple of good tools about how you can do it effectively. So just really a brief introduction about Placer AI. It's the most advanced location analytics platform describing physical locations, audiences, and businesses, and hence the applicability to what we're talking right now. we've been blessed to partner and trusted by over 4,000 customers in 30 plus different industries. So we're not just serving the healthcare industry, every industry that has interest in location, audiences, and businesses. You can see some of the amazing customers that we have are growing footprint in healthcare. Next slide is to talk about, okay, so what does that mean, location analytics platform? How does the magic work that you can create insights? So this is the way to think about it. And I'll start from the left very briefly. We observe foot traffic data. How do we do it? We have access to over 30 million mobile locations that are moving on the US map at any given time. And before you kind of freak out about privacy, we have no information about who those people are. Those are basically mobile apps that get permission to track you 24/7, think weather app, navigation app. We only get the dot that's moving on the map. And that panel of dots that we have is roughly around 1 out of 10 Americans. From that, you can extrapolate with high confidence level to the entire population. Compare that to census data that basically uses 1% to extrapolate. So it gives you a really good, robust data set, and it's also very fresh. The data is 7 years old, and it's as fresh as 2 days ago. Okay, now I've got a dot on the map. What do? I analyze every location because I can see where the dot is moving. And when it's going into a location, that's a visit. If it goes into a clinic or a hospital, I can go know at what time, how long does it take to get there, how long you've been there. I can see what other places you are going to in terms of groceries or restaurants or any other activity. And from that, you basically start creating a lot of analytics and insights about each and every one of those locations. We can tell if it's a residential area, we can tell if it's a commercial area. And then on top of that, that's the third piece, we enhance it with a lot of additional information that helps create a more kind of insightful understanding of that audience. It can be crimes data, it can be traffic data, it can be psychographic data, it can even be digital consumption data. Our model and with our scale is about adding a lot more data points to allow you to have a really good set of information, dots to connect, and from that we generate actionable insights. That's basically the secret sauce behind the location analytics data. Yes.
Just to add one point, we really focus on utilizing machine learning in order to get to those insights. And so it's more about like taking all the insights we have from our panel, combining those insights with other insights that can tell a full story, and then thinking about what sort of actual insights we can share with companies that can help them in their strategic decision making. And so just to add to Tomer's point, that Placer plays a big role in helping people better understand their audiences as a whole.
100%. It's a very good point because especially healthcare is got very sensitive data. Nothing that we do has any personal information, PHI information, none of that. We actually use machine learning and technology to create insights that are really smart without any complication or violation of any privacy or data.
Absolutely.
So this is a little bit the secret sauce of how analytical platform works. Now let me show just the examples. Okay, so what can I do with that type of data? That sounds interesting.
Yes,
so if you go to the next slide, I'll show just a couple of really good examples. Number one, you know a lot about yourself, I would argue. You know each and every one of your stores or your clinics, how many patients are coming, what are they doing, but you don't have the full context of the market. And that's where Placer can help you very quickly. And if you look at the bottom, you can see some of the basic questions that you can answer with such information. You know, how are we doing compared to our competition? And it can be in a specific location, in a battleground, or in a market, or even nationwide if you're looking at your chain versus somebody else. You know, you can get better context because you can look at a location, you can say, hey, we had a terrible year. We kind of are flat. We did not grow. But maybe when you look at the market, you actually see that your competition shrink 20%. So actually your market share actually went up. Or the opposite is true, that you went up 5%, you think you're good, but your competition went up 20%, so you're actually at risk. So getting context of how you're doing versus your competitors is important. And the last part, if you look at the third question, is also, okay, so there's a certain dynamic between me and my competition. Maybe I'm beating them, maybe they're beating me, but I want to understand better what differentiates me from them, right? Again, you know a lot about yourself. We can help you understand more about your competitors. You know, who's their profile? Are they targeting the same type of people as you, or maybe differently? And by looking at those type of things, you can start creating specific strategies that allows you to compete and do better in the market. So pretty simple example, competitive intel.
Yeah, awesome. And then I think we have one more example.
We do have another example, a more sophisticated one. If we can move to the next slide. Now this is about, and this is again a classic use case. You have, let's say, an urgent care retail chain or primary care, and you want to expand. You want to move into other locations. How can you find the right place for those, right? And I'm sure when you look at your locations, you've got some that are doing really well, others that are maybe not as well as you hoped for, right? So what we are doing, first of all, is we take the entire chain of stores and we analyze them. We take the top quartile, your best performing locations, and we try and understand what's unique about them. Why they're very successful? What type of demographic is working there? You know, what's the trade area? What's the capacity of people in that location that makes it very successful? Different things like that. So we're trying to find rules and indicators that says those are your money makers. Those are the really good locations versus the ones that you struggle with. And then we apply them on a map, and in every area that you want to try and find you similar locations that will give you the same type of impact. So if you look at the map, you basically see the blue dots are basically your location, your chain's location, and the green dots with the letters, the gray letters, are basically the recommendations that our platform provides to help you understand what's the next best location to go after. And I'll share one more important thing to explain it, because everybody has a little bit of a different flavor in the way that they're running their business and what's important to them and works for them. We recognize that. So if you look at the middle box here, the one that said score setups, we're basically looking at 4 key parameters. We're looking at the trade area population. Basically, how big is the area, right? That's important. You want to go into an area that is as big as possible, right? You have the maximum chance to get more patients into your location. Second is cannibalization. You want to look at how close other locations of yours are to that area. If you have something close by, maybe that's not smart to add another location. And sometimes it is, because there's already brand recognition. And you can see that next to each and every one of the configuration, there's also a relative weight that you can apply. So you can say, I don't mind cannibalization. It's actually a good indication. So I'll dial it down. It's between 0 and 1. The next is demographic fit. You can say, hey, I'm really, really good with young families or the elder population. So we look for areas that have exactly that type of population in those areas. And even there, I have a good story about a company that's building urgent cares, and they went into an area in a big metropolitan area that the demographic score was low, but it wasn't bad because they were actually going into a new population segment, the Latino population, that is very strong in that, and that's fine. So you just dial it down and you can adjust a little bit that. And lastly is competition density. You want to see how many competitors are in the area. And part of what we do is not just we're putting the competition on a map, but we actually know where people are coming from. So you can really see the trade area, the area where people are driving from, and that helps you make the decision. So to make a long story short on that front, is if you are in the business of expanding, you want to add 5, 10 more locations, it's such a big decision. It's strategic, it's expensive. You want to minimize mistakes. So being able to use data to help you find the best next location is important. And that's how we help, and others can help with location analytics to answer that question.
I love that. And to the point of retailization of healthcare, I mean, retailers have been doing this for years where they'll assess what type of SKUs that they should sell in a given store and what audience connects with those SKUs and where they should put their locations depending on the right audiences. And it's really just applying that same sort of thinking to healthcare. And not only can you pick where you put your locations, but the services you offer. So I can imagine if you're looking at certain attributes and you're saying, hey, in these with these certain population, it's really important that we offer these services, and our services tend to do better when we put them in these locations. Like, it's really thinking about ways in which not to determine just where it's located, but also advance the services that you offer to meet the needs of your local community.
100%. 100%. And I can add, if you go to the next slide, just a success story,
Awesome.
which we just recently released. And this talks about not just adding new locations, but potentially optimizing an existing location. This is a case study of a leading urgent care retail chain. And they came to us and say, hey, we have a location that is underperforming. And we're not sure why, and we're trying to figure out how do we change the projection of that location, because we believe that area should be good. And what we've pointed to them is two things. We said, A, your current location has a limited access point in terms of drive. There's only one road that goes there. There's a lot of traffic there, again, talking about those additional data sets. So ideally, find a location that has multiple ways to get into. And you can see on the map, that's the new location. You can easily get from all directions into that. Second is, we said also that there is nearby a really emerging shopping center with over 30% growth year over year in terms of foot traffic of the demographic that you care about. And if you put your location there, you have a much better chance to make it more successful and adopted. 3 months after they made the change, they doubled their patient size. And that created a really impressive return of investment. So the point I'm making is there's different way to apply data to kind of help you make that smart decisions about where's the perfect spot to put that clinic that will get my community to have the easiest access to come and engage with me.
Yeah, I love that. What an impactful story. Now, I know we have a set of key takeaways we want to make sure we walk through before we get to Q&A. So if anybody has any questions, please feel free to submit them. We're excited to answer them. So to walk through a few of the key takeaways. One, we talked about some of the key trends in healthcare. So the advancement of telemedicine and digital health services. Who doesn't love the ability to take care of your health without necessarily needing to go into a health facility? We talked about the focus on the consumer and making sure that we're serving the consumer in the right ways. And we talked about the retailization of health clinics. Specifically, when you think about like and there are higher visits and wealthier people who go into the retail locations that have health services, really focusing on families. And then, of course, convenience is a big part of that. And then Tomer gave a great summary on these use cases. I mean, market positioning, site location, performance benchmarking. Any other additional use cases, Tomer, you would like to share while we wait for some questions?
Yeah, I mean, I think if you can go maybe a couple of slides further, I have like just a summary slide of some of the potential use cases here. So just in general, the kind of the type of personas or functions that usually adopt location analytics solutions are either real estate and expansions, and marketers. And again, on the strategy side, it's the competitive intel, it's identifying consumer insights. So people doing benchmarking. Hey, what's the average time that it takes people to get to a clinic? That determines, okay, what's the right place to look for that next location. When it comes to real estate, as I've mentioned, it can talk about expansion, it can talk about closures or relocations. Even sometimes when it comes to negotiation, you're trying to negotiate a different price, there's tactics to do it, looking at data that shows the importance of you as a tenant to that area that you're in, and that gives you leverage. So people are using that. And on the marketing side, it's a lot about how do I get additional insights into my patient's audience and the potential patient audience. I know a lot about them when they're coming into to the clinic, but I can know by using location analytics where they came from before, where they're going after, what other type of favorite places do they like to, so you can look for those type of potential partnerships. We can help you understand in which zip codes are you winning or losing in every battleground, and then you can kind of tailor your efforts, your marketing efforts into that. So a lot of kind of tactics on the marketing and advertising front as well.
Love that. So I judge a webinar by the number of questions, and we are lucky because we have quite a few questions. People are really excited about this topic. So the first question, how do you collect competitor data for analysis? And I think the question is more asking, can you collect data on any company within the United States?
The simple answer is yes. Because again, looking at the dots on the map, we can basically track the visitation to any location. It can be a specific clinic, it can be an area, a shopping center, a retail node, a city, movement between states, you name it. It's all coming from that. And that's really the one of the base promises of Placer, that we can add that incremental insight of how am I doing versus my competitors? What can I learn from my competitors that will allow me to better compete in the market? It's really a way to get a competitive edge.
Got it. Thank you. And then can you perform targeted tracking by selecting specific apps through which tracking is done? In other words, track mobile that are using a specific app to better understand location analytics of a specific population using the app.
So the simple way to think about it, and that's something specifically I can talk about Place. So we put tons of efforts and investment into building a wide panel of over 40 different mobile apps that we partner with directly. It's not through a third party, it's all direct partnership. And we selectively are looking for versatility in terms of the apps, because we want to make sure that we capture a lot of the different audiences, right? We want to make sure we capture the elder population. We want to make sure we capture rural areas and so on and so forth. So by intent, we're trying to bring as many type of apps into the fold. And also, as you mentioned, we have over 260 data scientists that part of their job is to debias and to extract and to really put the efforts to ensure that our data is accurate and valid to allow you to make the right type of decisions.
Absolutely. But all of our insights are pulled together, as we mentioned earlier, through machine learning. So we don't necessarily track a specific app. What we do is have insights that we culminate together that we can share with our clients to help them better understand trends. And what we know is that our trends tend to be incredibly accurate, which is why we've done really well across so many different industries. Another question, can you tell me how easy it is to implement location analytics within a company, especially when you're thinking about deploying a new strategy?
For sure. And again, I can definitely say it with confidence about Placer, but I can assume that it's similar to others. One of the great benefits of location analytics approach that we are deploying is that there is really no data exchange. You as the provider don't give us any information, any sensitive information, any information at all, of course not sensitive about your patient. So there's no heavy IT, there's no HIPAA compliant, there's no a lot of risk associated with that. And again, from our perspective, there isn't any personal information as well. It's basically a survey tool. So in short, It's really with no risk. It doesn't have any implementation. I've been to the healthcare space for 15 years. I used to have black hair. Now I have a lot of gray hair because of all of those integrations and data projects and IT resources. You dodge all of them. It's a pretty simple engagement, and you are basically just onboarded, trained, and you can start using it a day or two after you sign a contract. And I love things that potentially, once you sign up, you can get value the next day, right? So I would argue one of the charms and one of the motivations of looking into location analytics is the fact that it's super easy to start adopting and using.
That's awesome. And this last question is a bit of a fun one. Can you both share what you're most excited about in the healthcare space? What are you most excited about generally, Tomer?
I'm excited about a lot of things. I would say probably the emerging of generative AI into the healthcare space. I'm a big believer in that. I've been in the e-commerce space when we basically started using machine learning and scalable technology instead of tagging different data points in a manual fashion. We started manually, then we trained the machine, and it started to do it. And the reality is, it's cheaper, it's faster, and it's also more accurate.
Yeah.
And you can see that, I live in the Bay Area in San Francisco. There are cars now, automatic cars that can take you around to different places. It's kind of freaking out to go in the first time, but I am wholeheartedly a believer that at the end of the day, we'll have less car accidents when it will all be done in an automated fashion with all the smart technological
Advancements.
rail guards.
Yeah.
And healthcare is the next one in line. We can do a much better job analyzing imaging, looking at different data points, understanding what are the right diagnosis or treatment that can work, instead of using people that are trying to do it in a defined amount of time. You basically use this power brain to do that. Obviously, it needs to be done smartly. It needs to be done responsibly, but I am a big believer that we will get the next jump in terms of healthcare outcomes and services with generative AI wave.
I love that. It's interesting because Gen AI is something that in technology we've talking about for years, but as more and more people learn about it, all the different use cases, it's like blowing your mind because you're like, our world could be fundamentally different in 5 or 10 years, especially in areas as important as healthcare. So it's super exciting. I would just add to that, I'm also super excited about the focus on wellness and making sure that we're thinking about preventative care within communities and utilizing these technology and these insights to help people get better understanding of their own health quicker so that they can solve some of those health issues before they really occur. And so super excited about that. And then naturally, everything that we've talked about today with the retailization of healthcare, just this constant focus on how do we better serve the consumer, how do we better serve the customer and the community. It's all very important, and Placer AI I know wants to be a big part of that as well. And so with that, I just want to say thank you so much to Health. Thank you so much to Tomer. I mean, you always provide a wealth of information around healthcare and definitely a leader in the space. So always appreciate connecting with you. And thank you so much to our audience. I mean, we're so happy to be able to share not just this important topic, but also share some important insights around technology and Gen AI and the future of healthcare. So super excited to engage with you. And please feel free to reach out to us if you have any questions or you want to connect. We are always happy to connect.
Thank you to Placer AI and to everyone that joined us today. Please visit our website at community.hlth.com to catch up on all Health Go Live webinars. And join us in Las Vegas, October 20th through 23rd for Health 2024.